is the difference after all? You've probably heard in the news recently. I think there's been a few articles, a few things in the news about Medicaid. Ari, don't you agree? We've got Ari from Chapter Medicare here. My name is Ed Weir, and yeah, I think Medicaid, Medicare, all that stuff is in the news.
Well, they're both in the news, as
Yeah.
your viewers are pointing out in the comments. And it's great to be with you again, Dr. Ed.
Yeah, thanks for joining us. I appreciate it. Yeah, everybody loves when you join us. I think it's so they don't have to stare at my face for an hour. They get someone else, yeah, better looking to stare at. So it's a beautiful thing.
I did get a haircut for your audience.
All right. So, what is the difference between Medicare and Medicaid and Advantage and supplements? And what is all this and about the news about cutting Medicare? And now the new thing out is cutting Medicaid. And the brand new thing out is come out probably in the next 24, 48 hours, as if there's also some possible cuts to Medicare. Okay, so Ari, you want to give us the scoop on what the difference is between Medicare, Medicaid, and who can get Medicare versus Medicaid?
Yes. So Medicaid is for Americans who are below a certain income threshold. Medicare is commonly for seniors. It's for Americans who are typically 65 or up. And we'll get into the nitty-gritty of how to apply for Medicare when you're approaching your 65th birthday. But there is another way that you can get Medicare, and that is by way of disability. So if you have received cash disability benefits for 24 months or more, that is an alternate way of qualifying for Medicare. And there are also a couple of very serious illnesses that would qualify one for Medicare, including end-stage renal disease and Lou Gehrig's disease.
Yeah, my regular viewers know this, but we've got finally got my website is up. It's a work in progress, getting the videos there. But yeah, if you go into my website at mygovexpert.com, it's not gov, it's not cov, mygovexpert.com. It's a private site. I'm no longer affiliated with the Social Security Administration. I retired from there. But it gives you all of the details about Medicare, Medicaid, supplements, Part D, IRMA, all the rest of it. And he had just mentioned, yeah, there's two things there. You can get it anytime at any age if you have ESRD and Lou Gehrig's disease. I think those particular diseases, those disabilities, had some politicians that kind of push these special considerations for those two conditions. And I wish they had done them for all of them, getting Medicare quicker and all the rest of
Right.
it. But that's the job we have to continue, right?
That's right. End-stage renal disease was set up as an alternate way to qualify for Medicare in the early 1970s, bipartisan agreement between the Nixon administration and Congress. Imagine that.
Yeah, imagine that. Yeah. And considering, Johnson just started Medicare back in 1965. So some changes pretty quick. All right. So Medicare. Yeah. So you sign up through Medicare through the Social Security Administration, Part A, Part B, and then there's all the rest of it. Because Part A and Part B is awesome. And, obviously it could get better. Part A covers your hospitalization. That's $0 premium per month. Part B covers your doctors. And that is this year's $185 per month. There's big gaps in there. There's 6 big gaps to original Medicare, the biggest being the Part B coinsurance. So if you go to the doctor and get a $100,000 Band-Aid, you have to pay $20,000 out of your pocket. So people get either a Medicare Advantage plan or a Medicare supplement plan. So you want to go into a quick the differences between supplements and Advantage?
Yes. As you mentioned, Part A and Part B come directly from the government. Best way to apply is through your online Social Security account portal. It's fast, safe, and secure, and that's the fastest way to activate your Medicare. It's not calling the Social Security Administration. You're going to wait on hold for hours, and they won't help you over the phone apply. They'll set a callback appointment. So you definitely want to do it through your online Social Security account portal. Now, what people are surprised to learn is if they just have Medicare Part A and Medicare Part B, they don't have comprehensive insurance because original Medicare only covers 80% of your medical expenses. The other 20% you owe out of pocket. So Dr. Ed mentioned a $100,000 Band-Aid. Let's talk about a $50,000 knee replacement. You would still owe $10,000 for the knee if you just had original Medicare. So that's why people consider some type of additional coverage. Two options here. Medigap, which sits on top of original Medicare and covers the 20% you'd otherwise owe out of pocket. It's also known as Medicare Supplement. The second option is Medicare Advantage. Medicare Advantage is what you commonly see advertised on television. You could pick your favorite Medicare Advantage spokesperson, Joe Namath, William Shatner, Jimmy Walker, the list goes on.
Yep.
This is a replacement for original Medicare administered by a private insurance company. It's managed care. Here's where we get into the world of HMO and PPO network restrictions, unlike original Medicare, which is networkless. This is also where we get into the world of prior authorizations. And in 2023 alone, there were over 50 million prior authorization requests to these private insurance companies under their managed Medicare plans. So definitely something to consider. And you can only choose one or the other. It's either Medigap or Medicare Advantage. You can't have both.
But if you get a Medicare supplement plan, then you also have to get a prescription drug plan, because the Medicare Advantage, most of those come bundled with the prescription drug plan in them. But with the Medicare supplement plan, you also have to get the Part D plan. And a lot of people, I'm seeing way too many people, I'm sure Ari, you as well, that have someone help them get a Medicare supplement plan, and then the agent, Medicare insurance agent, says, hey, let's also find you a prescription drug plan. And then people say, oh, I don't take drugs. And the agent says, okay, bye. And then when they do sign up for it, then they're penalized. So I'm seeing that way too often.
That's absolutely right. If you go with Medigap, then you want to add a standalone prescription drug plan. Now, these are two separate coverages. So you apply for your Medigap plan and you separately apply for a standalone prescription drug plan. If you go with Medicare Advantage, then most Medicare Advantage plans come bundled with prescription drug coverage. So just something to keep in mind. If you go with Medigap, it's a la carte to add the standalone prescription drug plan.
Perfect. All right, let's we'll continue talking about the differences, but we'll throw in some questions as well. Maria asks, why do you have to pay Part B of Medicare, and what can you do? Yeah, it's like, wait a second, I paid for Medicare for decades through FICA. So when you pay your FICA tax, your friend and on your check stub for all those decades, and it's like, who is this FICA person? I've never met this FICA person. It's basically Social Security 6.2% and Medicare 1.45%, and then your employer pays the other part. But yeah, you pay Medicare for decades, and then when you actually sign up for Medicare, you have to pay it again, $185. The Part A is zero premium for most people, but the Part B is $185. What's the deal with that, Ari?
So your Medicare payroll tax is going towards the Medicare Part A trust fund. There are three parts to Medicare. There's hospital insurance. That's what your federal payroll tax is going towards. Then there's Medicare Part B. That's everything outside the hospital. That's what your Medicare Part B premium is going towards. That's why it's $185 per month for this year. And then finally, there's Medicare Part D. And as Dr. Ed mentioned, some people are surprised to learn about Medicare Part D. This is the drug benefit. But if you don't sign up for it, then you would owe a Part D late enrollment penalty unless you have drug coverage at least as good as what you would have received through Medicare.
Yeah, and that was a big issue, the Part D this last year during, was it October, November, December, that the CMS came in and they said, hey, a lot of these private drug plans are not creditable coverage anymore. And then everybody freaked out and said, what are we going to do? And then they kind of kicked the can down the road. And so, yeah, and I think there's going to be a lot happening this year too. So it looks like we got questions about Medicare being cut. So we see that there are, hundreds of billions of dollars being cut from Medicaid. And I did a video on this a little while ago, that that's also for a lot of people, cutting Medicaid is also cutting Medicare, which is
Yeah.
also cutting your Social Security benefits. And people say, no, everybody said they're not touching Social Security or Medicare. Well, not directly, but behind the scenes, there's millions of people that receive what's called a Medicare savings program. They sign up for Medicaid and they get these particular levels, QMB, Slim B, QI, and the state pays for their Part B premium, that $185. Okay.
Right.
Once those people get kicked off of Medicaid, they lose a lot of coverage, health care, and they also lose that $185. So essentially, their check is going to be reduced by $185 a month. And these people, because they, were on Medicaid, they're obviously low income, low resources. To take another $185 hit is very, very difficult. And people on dual eligible plans also get those grocery cards, which
On
Ari and
some.
I hate those companies out there advertise them in YouTube and Facebook and TikTok, but because they advertise them in a really scammy way, but they do exist. And a lot of people are dependent on those, $100, $200 a month, and they lose that as well. And unfortunately, I've seen this personally working at the Social Security Administration. People come in and then say, hey, I just can't afford the $185. And they say, I'm not sick right now, so I'll just go ahead and stop it. And we say, yes, we're not sick right now. But that could all change tomorrow, fall down, get in an accident or something like that. But people said, yeah, I just have to take the chance. And so they stop Part B because they can't afford the $185. So it's unfortunate. And they're talking about through the
Can I say one more thing?
Absolutely.
I know we mention this on every video, but Medicaid goes by different names depending on the state that you live in. And this is so important. So here in Arizona, it's called Access. In Alaska, it's called Denali Care. And it just depends on the state you live in, what your Medicaid program is called. And if you lose Medicaid, you can appeal that decision. And you can lose Medicaid for a reason as simple as moving. If you don't update your address timely, you might lose Medicaid, even if your income hasn't changed. And so in those situations, you would certainly want to reapply to see if you can reestablish your Medicaid eligibility.
Yeah, the on my website, I'll pop it up there on, if you go into it, click on Medicare, click on the far right one, it says Medicaid, and then it tells you what Medicaid, and it says, hey, I lost my Medicaid. And it gives you an idea of what to do. You can appeal your Medicaid. And I'm adding a little bit more to that little section because before I worked for Social Security Administration, I worked for the Department of Social Services doing Medicaid. So I'm going to add some more information on that. I wonder if they're going to change the name to Alaska Medicaid from Denali Care to McKinley Care, since there's trying to change the mountain.
You've been
too,
workshopping
right?
that joke for weeks. One more thing on this point.
Uh-huh.
Even if you earn too much to qualify for Medicaid, let's say your Social Security check is a tad too high, you still might qualify for Part D extra help. Part D extra help is administered through the Social Security Administration, and Dr. Ed's website has information about this too. And so even if your income is too high to qualify for help with your Medicaid, or even if it's too high to qualify for Medicaid, you still might want to apply for Part D extra help. And this can provide substantial savings. The Social Security Administration estimates it's over $5,000 per year in savings if you're on expensive medications.
And it's one of the easiest applications to do at Social Security. You can do it online, you do it over the phone. I've taken hundreds of thousands of those, and it's one of the simplest applications at Social Security. Abby, the cuts in the big beautiful shill is even more terrifying than the previously known. So, all right, let's clear the air on cuts to Medicare. So there are direct cuts to Medicaid in the bill. Are there direct cuts to Medicare in the bill? Are they direct cuts?
Dr. Ed, the proposed legislation was just released an hour ago. And so I think what is in the proposal is there's no offsets for it would force mandatory cuts to Medicare potentially. That's my understanding. Unless they're offset through pay as you go.
Yeah, so was it pay as you go? That started in what, 2010, and they said, "Hey, if there's a deficit, then there's automatic cuts. You have to find those automatic cuts somewhere else." And part of sequestration. So you have to sequester part of the budget. You have to separate part of the budget and say, "Hey, we've got, was it over $3 trillion of deficit spending here." So that automatically triggers this pay go system, and the Social Security is not in the pay go system. It's exempt from pay go. Veterans benefits are exempt from pay go. The biggest thing available in the budget that can be a target for pay go is Medicare. So basically what it says is, hey, you've got a deficit here. You have to find savings someplace else. The biggest place you can find it is Medicare. Go for it. And it says, what, 4% or
4%.
something is
Yeah.
4%. Yeah. So they are
And
estimated next year, what, $46 billion will be cut for Medicare next year?
yes, a mandatory, it'll be withheld from the Medicare budget
Yeah.
if this isn't offset through, as Dr. Ed mentioned, pay-go extension. Now, in the past, it has been offset, but that's not, and it under the legislation that had been proposed earlier than today's release, I believe that there hadn't been mandatory cuts that were going to go into effect. But as it stands today, based on the version of legislation that was released this afternoon, it appears as if it would force Medicare to withhold 4%. And this would have an effect on doctor reimbursement rates. It would essentially reduce the level of care Medicare beneficiaries receive. And there's over 70 million Americans on Medicare. So this is highly consequential to your viewers.
So how would it, in terms of, so this is a 46 billion cut next year. So a lot of hospitals throughout the country, they're going to, particularly in rural areas, are going to have a really, really tough time because they are dependent on Medicaid, and they're going to lose a lot of their Medicaid. Was it about 8 million people are going to lose health insurance through Medicaid? And also that doesn't even include the Affordable Care Act. There's, I think it was a total of about 14 million going to lose health insurance. Well, they're not going to lose health care because
even higher than
yeah,
that.
yeah.
I've read that as many as 10 million people on the Affordable Care Act exchange might lose their health coverage because they won't qualify for the premium under the Affordable Care Act exchange, which again is separate from Medicare. So the Affordable Care Act exchange is for someone who's not entitled to premium-free Medicare Part A. That is, it's typically people who are self-employed under the age of 65 or between jobs, let's say. That is another way of obtaining health insurance, the Affordable Care Act exchange.
Yeah, all of this is, because there's health insurance and there's health care. Nobody's going to lose their health care, but their health care is going to be the emergency room, like in the old days, right? And because people are not going to be able to pay it, then they don't want to go bankrupt in debt because they don't have health insurance. They're either going to go to the emergency room or they're just going to ignore it. As we used to say in the Marine Corps, did you try walking it off? So they're going to walk it off. And unfortunately, when that happens, if you don't get stuff taken care, immediately sometimes, then it turns out far worse, which costs everybody even more money. So a lot of these hospitals, they depend on Medicaid, Medicare. And if those get cut, we're going to see a lot of rural hospitals closing down. We're going to see doctors decide not to take Medicaid, not to take Medicare because they're going to be lower reimbursement rates. Those Medicare Advantage plans are going to probably be dialing back those extra benefits. So there's always this ripple effect.
Right. We don't know what the second order effects might be of the proposed legislation. And none of this has passed. None of this has been voted on yet. So again, this is just the proposed text of the legislation that Dr. Ed and I are commenting on as of May 21st.
Yes, exactly. Yes, I always do that. May 21st at 3:20 p.m. West Coast time. Those are the facts as we see them. Focus Lady, I had a great doctor appointment today with my new insurance. Thanks to Chapter. Awesome. Good deal.
Thank you, Focus Lady. Yes.
All right. Yes. All right. So, and remember, The reason my son and I chose Chapter to help you all out is because Focus Lady Chapter help you, find the best plan for you, and you're happy with it. But remember, they don't end there. One of the main reasons we pick Chapter is because if you have an issue, if the next time you go see the doctor ain't as good as they were the first time, then you need to find another doctor. If you get some type of strange bill from this doctor and you don't understand it and you can't get a hold of your insurance company, you have the second option, to call the member success team at Chapter, and they will help you out. That's the awesome part of Chapter, is they got that ongoing member success team that helps you out with all of those issues.
That's right. You're supported by two teams here at Chapter, not just our Medicare advisory team, also our member advocate team, which is your first line of defense when any questions about your insurance come up. You call Chapter rather than the insurance company, and we get to the bottom of it on your behalf.
Perfect. Uh-oh, here we go. Nona. Ari, I'm sure everyone would want you as their advisor. I feel like you're a friend. Awesome. Is it possible to talk specifically to you? Hope the new baby as well. Oh, wow.
Oh,
Wow.
no, that's so sweet of you, and thank you. Yes,
Ah.
my daughter is doing really well. If you hear her in the background, I apologize in advance. Now, I oversee our Medicare advisory team, and I can guarantee you that you're going to be very happy with the expert that you work with here at Chapter. And so while it's unlikely that I'll be on the other end of the line, I can guarantee that you're working with someone who has years of experience and has helped thousands of people choose the right Medicare coverage.
Perfect. All right. Robert, okay, this is, yeah. I think we talked about this a little about the last time, but yeah, it's good to revisit. How can I get the calls to stop asking if I have Medicare Part A and Part B? I do have it. I'm not changing it. These scam calls happen 5 to 8 times a day. Wow, you're actually pretty good, Robert. That's not too bad. I'm sick of them having been even told them to stop calling. All right. So what's the deal, and what are the solutions for this, and what did the government try to stop this, and who are these people and why are they doing this?
So Robert, the best advice that we had from polling Dr. Ed's listeners in our last Q&A was to silence unknown calls on your phone. That's really going to be a great defense against people who are interrupting your day, asking if you already have Medicare when you've been on Medicare for several years. Now, in terms of what you can do, well, you can add yourself to the National Do Not Call Registry, although I imagine you already have, and they're still harassing you, and I'm sorry about that. And it's just something that Medicare advisors are not allowed to do. They must have your permission in order to contact you. That if you put your number in the chat right now, I cannot call you. A member of the Chapter team can't call you. You have to give your permission to contact in order to be reached. Now, another tactic, and this is an easy one. If they text you, you can say stop in all caps, and they should opt you out of their text messaging. But that might not stop the phone calls.
Yeah, that's and the people that do this are already doing things incorrectly from the beginning. So if someone calls you and you didn't specifically ask them to call you, then they're doing things essentially illegally. So yeah, those are definitely not the people you want to have help you out with all the rest of it if they don't know the basics of, yeah. So yeah.
I'm sorry that's
Let's
happening to you, Robert.
Yeah. Let's see here. I can't pay Medicare Part B because I do so means I can't pay rent, food, etc., water. Fortunately, I'm in good health and don't need Part B. The expat guide. Make
Right.
sure you check out my in my YouTube description. It has living on Social Security alone, and I put there my video that talks about 50 different programs that might make your life a bit easier. So definitely check out that video. In terms of Part B, remember, you're going to get penalized when you actually do sign up for Part B, 10% for every 12 months you didn't have it. Please reach out to Medicaid. If you're low income, low resource, reach out to your state Medicaid, whatever they call it in your state, and apply. And if you're approved, they will pay for your Part B, and you'll get other benefits, possibly depending on your state and your level. And It should make your life a lot easier.
Yeah, and this is an expat, so that means they live outside the United States. So they might be in a position where they don't need Part B because they're getting health insurance through, for example, a national health program. That could provide you with an exception. But that situation is probably not like the other viewers here who are having trouble affording their Part B, but they need to access care in the United States.
Exactly. And I didn't notice the name there, but yeah, Expat Guide PH. So I figure Philippines. And Philippines, the national health insurance in the Philippines, I'm almost certain is not considered creditable coverage. Some countries are. If you're part of the national health insurance in particular countries, that is considered creditable coverage to delay Part B. So.
And just a quick shout out. There was actually a viewer who, while we were answering the question, talked about the totalization agreement with the Philippines and how it doesn't count as creditable coverage.
Oh, okay. All right. Somebody jumped in there. All right. We got an awesome audience like that. I saw my primary care physician and she told me not to get an advantage because there's a big penalty when I turn 65 and try to get my original Medicare back. Turn 65. So this sounds like this person is receiving disability benefits and the physician probably in the right direction. Never tell anybody, you have to get advantage, you have to get a supplement. Every particular situation is different based on your budget and everything like that. But hopefully the physician knows that in most states, if you're under 65, you can't get a Medicare supplement. So the only option you have is a Medicare Advantage, correct?
Right. But then when DAR turns 65, it opens their Medigap open enrollment right, which means that they are entitled to purchase a Medigap plan without any questions about their health history. They can't be discriminated against for any pre-existing conditions, and they must be charged the standard rack rate. So I think your physician is on the right track in mentioning that you have your initial enrollment period 2 as a result of turning 65. And so you would definitely want to do your comparison between Medigap and Medicare Advantage. And a great time to do it is 3 to 6 months before your 65th birthday.
All right. Yeah. And those, so somebody said prior authorizations are why we went with Plan G. And remember, those Medicare supplements, in terms of Medicare Advantage, there's certain times of the year that you can switch and certain if you move or something like that. But Medicare supplement plans, you can change 365 days of the year, right?
Yes, you can shop your Medicare supplement plan at any time. In 46 states, you may have to answer questions about your recent health history. It's nothing scary like a life insurance exam. No one comes and takes your height and weight and draws your blood. But it's just a few questions about your recent health history, and you might potentially be able to save money, especially if you've been on a Medicare supplement plan F, as in Foxtrot, because the replacement for plan F is Medicare supplement plan G, G as in gold. And the only difference between F and G is G doesn't cover the Part B annual deductible, which is $257 for this year. So if you would save more than $257 in premium between your Medicare supplement plan F and your Medicare supplement plan G, then it might be worth considering switching. And you can shop that at any time.
And those plan Fs, yeah, those if yours plan F is not stable pricing, those things are going up because the pool, insurance is a pooled risk. The pool is getting smaller and sicker. So if your Medicare supplement plan F plan is able to increase based on the community or something, then those are really getting really high, aren't they?
It potentially. Typically, Medicare supplement premiums go up as you age, but that's not true across all carriers. And so this is why it's important to do an apples to apples comparison. Each Medigap plan letter type is standardized under federal law, but there's huge variations in price within given letter types. And so this is why it's important to work with an independent, unbiased advisory that has access to all the pricing information, not just a subset of insurance companies.
Perfect. Our supplement plans are great, but my husband's is $481 a month.
Ooh.
That's probably a plan F, huh? Mine isn't near this high. I guess it probably has to do with his health issues, right? It climbs every year. I don't think it's a health issue necessarily, right?
Mary, I
Unless,
would need to know quite a bit more about your situation to figure out how your husband's supplement is $481 a month. The first thing that comes to mind is your husband has been on their Medigap plan letter type for quite a while, upwards of 20 years, and in which case they've experienced a number of price increases to get to that $481 amount.
or they're in New York.
Even in New York, that strikes me as super high, Dr. Ed, unless, as
Yeah,
you mentioned, it's a Medigap Plan F.
right.
Yeah.
All right. Yeah, New York is the most expensive in the country. It's crazy.
Yep.
Um,
Yep. And just real quick on that point, the 4 states that are the exception that allow you to get a Medigap plan by way of guaranteed issue, Dr. Ed mentioned one of them, New York. The other 3 are right near New York. They are Massachusetts, Maine, and Connecticut. So those are the 4 states with year-round guaranteed issue for Medicare supplement: New York, Connecticut, Massachusetts, and Maine. And they tend to also be where Medicare supplement is the most expensive because they can't deny you.
all right. If Medicare gets cut, the $185 supports who? And do we have to pay this amount if we are disqualified from Medicare? Yeah, obviously the Medicare Part B premium next year will be increased, but we won't know that for a while. But yeah, if Medicare gets cut, yeah, you're still have to pay the $185 and be disqualified for Medicare. You can't really be disqualified for Medicare. You know, if you were qualified, you can't be disqualified unless, yeah, I don't think in decades I've never heard of anybody being disqualified for Medicare after they became qualified. That would have
Me
to be,
either.
yeah, you were
The
working under
only thing
somebody's
I've heard
record
of
or
is,
something.
yeah, it is cancellation of your Medicare Part B due to non-payment.
Yeah,
So if you
yeah,
choose not to pay the $185 per month, then yes, the government is going to cancel your Medicare Part B. And that's one of the primary ways in which people lose their Medicare. But it's a choice not to pay that $185 per month. And there's consequences.
yep, yep. So yeah, nobody could be disqualified. I guess the only, if you were qualified based on your work record and that turned out not to be your work record, then I guess you could be qualified. But yeah, I think I've seen that happen once in 20 years or so. So,
Yeah,
um,
that could be a way, though then they would
yeah.
just owe for Medicare Part A, right? They would just be charged a premium for Part A and for Part B.
Exactly, exactly. Yeah, that's what a lot of people don't understand is that don't realize that, you know, for most people that you pay into Medicare, you know, for at least 10 years, 40 quarters, then you get the Part A zero premium. For those that didn't, they can actually buy Medicare Part A and obviously still pay the $185 for Part B. But yeah, several $100s for Part A. It gets cheaper once you have more quarters. And once you have the 40 quarters, then it's zero premium. So
Or your spouse's work record.
there you go. A lot of people miss that. You can get money and Medicare from a spouse's record: spouse, current spouse, divorced spouse, independently entitled divorced spouse, surviving spouse. Yes.
Oh my
Uh,
gosh. So many.
yes.
You need that on your website, Dr. Ed.
Already got it. It's already up there. My Medicare cards came effective September 1st. So do I still have to apply for Medicare? Then do I apply for Part D help or after? Yeah.
Great question, Carlene. So it's so good that you already received your Medicare Part A and Part B for a September 1st effective. Remember, that's only going to cover 80% of your medical expenses. So to have comprehensive coverage, including drug coverage, this is where we get into the decision between Medicare Supplement or Medicare Advantage. And so you're at choice as to how to cover the other 20% of your healthcare expenses and prescription drug coverage that your original Medicare doesn't cover.
So now's the time to give Chapter a call and start kicking around those options and see what is best for you. Supplement, Advantage, Part D, all the rest of it. Let's see. Please discuss pay for service in lieu of advantage, direct primary care concierge.
I
So
love
this
this
is not
question.
a fee for service. This is one of those concierge services that getting a little bit popular for those that can afford it, I guess, right? It's going back to the old black bag doctor that used to come to your house type situation.
Yeah, it depends. Um, Concierge medicine can have its place. Now, original Medicare doesn't cover the fee for concierge medicine. So that is the annual amount or the monthly amount that you pay to your provider to, as Dr. Ed mentioned, have that black bag come to your house approach or to get special access to the doctor or texting privileges sometimes. Medicare doesn't cover the fee for concierge medicine. However, any Medicare approved services that your concierge doctor provides ought to still be billed to Medicare. And if you have trouble submitting any of those, that is what our member advocate team is here for. So as long as your provider works with Medicare, they still should be charging any Medicare approved services to the Medicare program, but you won't receive reimbursement for that concierge fee.
All right, Pink Owl. Hey, Pink Owl. Let's see here. Pink Owl is a member. Thank you for supporting us, Pink Owl. My sister works in human resources. Told me if original Medicare and original Medicaid are the best. Not sure why. Yeah, original Medicare, and then if you have Medicaid, Medicare supplement plans are off the table. You can't get a Medicare supplement plan because you have Medicaid. So the only option is to get a Medicare Advantage plan. And again, it's dependent on your particular situation. Those are the ones with the extra bells and whistles, and then some of them have those extra grocery cards that just might help you out $100, $200, $300, depending on what's available in your area. But one of the things, if someone has some type of home health care, it's often good to stay with original Medicare and Medicaid. Because if you go to a Medicare Advantage plan, again, if you have a home health care, somebody comes out to your house to do stuff. A lot of the companies will say, hey, yes, we can, Medicare Advantage plans. Yes, we've got home health care. But then there's nobody in your area that actually takes it or wants to do it because they get the home health care agencies, from what I've seen. This is my personal experience, Ari. So let me know if yours is different. But people that have that home health care, those home health care agencies like dealing with Medicaid directly. They get paid quicker and more, I guess, from Medicaid. So if you have someone coming out and say, hey, someone, I'm thinking about getting a Medicare Advantage plan. That extra $200 a month grocery card is really going to be nice, but are you going to stop coming out, or are you able to take this Medicare Advantage plan? Will you take it? And check with your home health person that actually comes out. If you really like them, you don't want to, miss them, you don't want to lose them, then double check before you go get that extra, $100 or $200 grocery card, just to be on the safe side. Does that
Right.
sound, you've seen the same type of things?
We talk about this every Q&A. You never want to choose a plan based on the additional goodies. The consideration of which plan to choose, whether you're looking at Medigap or Medicare Advantage, always boils down to your providers. You want to make sure that all your providers are covered if you go Medicare Advantage. Your prescriptions, you want to make sure that they're covered affordably under the Medicare Advantage plan of your choosing. And finally, your priorities. So again, if you value flexibility and choice of doctor, then Medicare Advantage probably isn't worth the trade-off. And it's certainly not worth sacrificing seeing the doctor that you've had a decades-long relationship with in order to get an additional goodie, like Dr. Ed mentioned.
Perfect. And yeah, unfortunately, those same people that harass people with all those calls all day, they're not going to tell you that. They're going to tell you, oh yeah, Medicare Advantage. Oh yeah, you do this Medicare supplement. Yeah, that's why we try
You
our
have to
best
take an
to.
education-first approach. And
Yep.
Dr. Ed, can I just give a brief plug?
Yeah,
I
absolutely.
just updated my book for 2025. It's a short book. It takes less than 90 minutes to read. The title is It's Not That Complicated. And it really isn't, as long as you have a good foundation. And again, Here at Chapter, we take an education-first approach, and we just want you to understand what Medicare covers, what it doesn't, and the choices that you need to make as you're approaching which Medicare plan to choose.
Perfect. Perfect. Julia, why do I get penalized for Part B if I had Blue Cross Blue Shield coverage? Why is it mandatory?
Got it. So, Julia, it sounds like you may
Federal
have had
employment?
the option of employer-provided coverage. So we would need to learn more about your situation. If you work for an employer or your spouse works for an employer with 20 or more employees, then you have a valid Part B special enrollment period to delay signing up for Medicare. And you
But
shouldn't
it
be
has
penalized.
to be through current work. It can't be the Affordable Care Act. Yours or your spouse's current work can't be retirement plan or anything like that. Yeah, so possibly that's why. Or you just forgot to turn in the paperwork to prove that it came from current employment. And if you provide that paperwork, it's a SSA 564, and you go to my website, it explains in detail how to do that. Then they'll roll back that extra premium.
Yes, it's Form L564 that your employer, it's a one-page form. You fill out Section A, your employer fills out Section B, signs at the bottom, and then you return that to Social Security.
Some drugs aren't even covered anymore.
Really
So
important.
I'm sure your member success team gets this all the time about I want this, I don't want the generic version. I want this version, or I want this. My doctor says I need this, but my prescription drug or my Medicare Advantage plan says no. What do I do? What options do they have?
So regardless of whether you choose a standalone prescription drug plan or a Medicare Advantage prescription drug plan, some drugs are subject to prior authorization. Also, because we're talking about many different plan options in a given zip code, the plan options vary zip code by zip code across the United States, and there's over 24,000 plans nationwide. Some plans will cover certain drugs and other plans won't. In order to be subject to the Medicare Part D maximum out-of-pocket of $2,000 for this year, which is the biggest change in a generation, the plan that you choose must cover each of your prescriptions. Otherwise, that medication isn't subject to the maximum out-of-pocket. Now, this is appealable, but we would just need to go through the prior authorization process in order to get that prescription covered, which means that your doctor says that it's medically necessary for you to take that drug.
All right, perfect. I have Humana Medicare and TRICARE for life. So do I have to drive to base, but I get mine free? I do wish I could have it delivered, though, because when my car is in the shop, I can't get my meds. So TRICARE for life, yeah, if you have TRICARE for life, that's essentially a Medicare supplement plan, right?
Right, but Dual's question, he says that he has, or he or she says that they have Humana Medicare and TRICARE for life, which gives me pause here. Because
Yeah.
if you're eligible for TRICARE for life, which means that you're a retired service member, you served our country for 20 years or more, thank you for your service, you get a $0 Medicare supplement plan provided for by the Department of Defense. And so you wouldn't want to add anything to that.
Yeah, I'm not sure why they've decided to add Humana Medicare. Unless live out in the country or something, want different. Yeah, but yeah, I don't understand why they would add. So some people do add, because they want the extra, gym membership or something like that. But you and myself and Chapter recommend pretty much against. If you have TRICARE for life, you're good. Particularly in terms of drugs, you're really good in terms of drugs
Really good.
because the
Really
Veterans
good.
Administration is allowed to negotiate drug prices. So
Yes.
yeah, that's strange that you would have that.
Yeah, the nature of the question just gives me pause, and I'd need to know more about the situation. So, Dual would love to hear more about why you're not using that $0 Medicare supplement plan from the Department of Defense.
Are we allowed to switch Medicare supplement and Part D brokers signed up to begin before hearing of Dr. Ed in chapter? Absolutely. How do they do that?
Christine, we'd be more than happy to help you evaluate all your options, not just the ones that you may have been told to sign up for when you first started Medicare. And let us do an apples to apples comparison. Perhaps you're already on the optimal plan. Maybe we can help you get set up with something that works even better.
Yep. And to make sure everything is good at Thanksgiving, if your agent that signed you up is a relative, then call up chapter and say, hey, am I in the best plan? And chapter will tell you, oh yeah, you should sign up for this plan. And if you want to sign up through chapter, go for it. But it might be a good idea to save Thanksgiving to call your relative and say, have you checked out this plan? Maybe we should switch to this plan. And that way everybody's happy in the family, right?
Well, yeah. So on your Medicare supplement, you can shop that at any time. But for your prescription drug coverage, typically the time to evaluate your Part D plan or your Medicare Advantage prescription drug plan is in the fall during the annual enrollment period, which is October 15th to December 7th. So don't even wait until Thanksgiving. Call in October. That's a great time to review your coverage.
I just want to make sure Thanksgiving, when all the relatives get together, the agent relative does not say, how come you cheated on me with chapter? What's going on? So I want to make sure family dynamics are nice and civil. All right. Let's see here. Part B is not mandatory. That is correct. Nothing is mandatory in life, as we used to say in the Marine Corps, but the repercussions are there. If you don't sign up for it, then you get the penalty. Well, Part A is mandatory, but again, Part A is not mandatory. If you don't want your money from Social Security, you have to give up your money from Social Security, because once you sign up for Social Security and you start receiving those monthly benefits, once you turn 65, you have to sign up for Part A. That's mandatory. Once you get your benefits. Part B, yes, you can refuse Part B, save yourself the $185. Very smart way to do it. The only time Part A is not mandatory is if you are having to pay a premium for Part A. That means you did not pay the full 40 quarters. But other than that, yeah. But if you are not receiving Social Security benefits and you turn 65, you do not have to sign up for Part A. You can delay until you stop working 67, 77, 87, 97, and then you sign up at that time. But yeah, you're correct. It's not mandatory.
Dr. Ed, a question from Daphne. I'm almost 65. When Medicare kicks in, are we required to get a supplement plan? As Dr. Ed mentioned, you're not required to do anything. But the best time to get a Medigap plan is during your Medigap open enrollment period, which is the 6 months after your Medicare Part B begins, because a carrier during that Medigap open enrollment period is not allowed to ask you any questions about your health history.
Let's see. Okay. Thank you for this information. I currently have an Advantage plan that I've been pleased with, although my location only has one option available. Wow. That changes every year. As we always tell people, with Medicare supplements, once you're on a Medicare supplement, then you're good, because those are standardized. A Plan G is a Plan G is a Plan G. Plans N, a Plan N is a Plan N. Medicare Advantage plans, those are only good for 1 year. People say all the time, so I've had my plan for 5 years. No, you've had your plan for 5 months. You had a different plan last year. And you say, well, it's the same company and the same card and all that stuff. Yes, same company, same card, but the engine, everything under there could have very well changed. Hopefully it didn't change that much if you didn't check, because what happens, we see too often, people say, well, when I signed up for this, last year or 2 years ago, 3 years ago, it said if I went to a hospital, I'd, only be charged $100 a night. How come I'm being charged $500 a night? Because that plan you signed up for is long gone. These plans only last for 1 year. They essentially sunset December 31st at midnight, and you get a brand new plan January 1st. If you do nothing, then whatever the insurance company says, that's your new plan. So that's why it's very, very good to check. And how can they check? And when should they check, Ari?
So I would need to know more about Crystal Blue Persuasion. I love that handle, Crystal Blue Persuasion. I would need
Oh,
to know more about their situation. I'm very surprised to hear that there's only one Advantage plan in their zip code, because normally there's at least a handful. For example, if you live in Cook County, Illinois, there's almost 60 Medicare Advantage plans, and that doesn't even include the dual special needs plans for those who have Medicare and Medicaid. And as Dr. Ed mentioned, the plans change year over year. The networks can even change mid-year on a Medicare Advantage plan. The prescription benefit changes, and there might be additional benefits that were important to you that are not offered for the upcoming year, or perhaps they've improved one way or the other. But it's important to do that type of review in the fall during the annual enrollment period from October 15th to December 7th. If you have a move, let's say, that gives you an opportunity to review your coverage before the fall, though. So there can be special election periods created if you have a change mid-year, like a move.
yeah, they're out west. I know in Montana, Nevada, Idaho, and stuff like that. There's
Wyoming.
yeah, Wyoming and stuff. Yeah, there's places with only one company, and I don't know if I want to mention the name of the company, but yeah, they are very, very sparse because there's no competition, so they can do whatever they want, pretty much,
Well,
right?
Medicare Advantage plan still has to offer benefits at least as good as what someone would have received under original Medicare. And it still puts a maximum out-of-pocket protector, unlike original Medicare. So if you just have Medicare Part A and Part B, again, if you have a $100,000 Band-Aid, that's a $20,000 boo-boo out of pocket, and sky's the limit on that. Under Medicare Advantage, you have a maximum out-of-pocket cap. So Medicare Advantage still beats original Medicare.
Yes. Yeah, I've seen some of those plans out there that's only one, but yeah, there's no dental, no vision, very, very limited networks, and yeah, customer service is very wanting. But at least, yeah, it's better than as just having Part A and Part B alone with all of the yeah, all the
And you
gaps.
don't have drug coverage if you just have Part A and Part B.
Yeah,
So
there you go. There you go. So something's better than nothing. But yeah, maybe reach out to your politician in that particular state, that particular area, and say, hey, we need more choices here, more competition. And that way they can up those plans and get you some more benefits, those extra benefits, like other places. I think the best, what Florida has pretty much the best Medicare Advantage plans. They've got all kinds of very, very low deductibles and max out of pockets and benefits and all the rest of it, right?
yeah, it even varies within parts of Florida, though. I think you might be referring to South Florida. The Medicare Advantage plans in South Florida can be very competitive compared to what someone might receive under a Medigap plan. But again, we have to go based on your 3Ps. What are
Right.
those? Your providers. We got to make sure if you're going Medicare Advantage that all of your doctors are in network. Prescriptions. We want to make sure that the Medicare Advantage plan you're choosing covers them affordably at the pharmacy of your choosing. And finally, your priorities. If you're traveling away from South Florida frequently, then that Medicare Advantage plan might not work so well for you.
Yeah, in Florida, I went to elementary and junior high in Florida and Bradenton and Homestead. And so, yeah, you mentioned South versus North. As we used to say in Florida, the farther north you go in Florida, the farther south you get. So Florida is like a different entity. So once you start going further north, you're further south in this, south part. Anyway, entirely different culture up there. Yeah, let's see. If you cannot afford the 180 give and afford supplement, you sure as hell can't afford to be without it. Yeah, that's what we always tell people, anytime you talk to anybody about changing your Medicare plan, getting a new Medicare plan, make sure you're fully educated. And how you do that is because there's a lot of people out there, not Chapter, but a lot of other people out there that want to get you a Medicare Advantage plan because they make more money. So it's good for them, might not be good for you. And so that's why I always tell everybody every single time, say, hey, I'm new to Medicare. I'm going to get my Medicare card. I just got it in my hand. Tell me about Medicare supplement plans. Make sure they start with that. And they explain the difference of Medicare supplement, what a plan G is, what a plan N is. And then you say, okay, now tell me about Medicare Advantage. And that way you've got the lay of the land and you can make a decision based on your particular needs, your particular budget. But it's important that you get all that information.
And you want to think of it as a long-term purchasing decision. It's longer than the decision of which car to purchase. A car you might have for 5 to 10 years. Medigap, you're probably going to have for the rest of your life. So if you have a chronic or pre-existing condition, then to pass up your Medigap open enrollment period could mean that that's your one shot at getting that type of coverage, and you're going to be stuck with Medicare Advantage unless you have a guaranteed issue, right? Which are few and far between.
Is it true that we have to resubmit another application every year for renewal of Medicaid benefits? Not necessarily a new application. You do have to get recertification depending on a particular state, because Medicaid is a needs-based system, and they just want to make sure you didn't hit the lottery or get a $20 million inheritance from a long lost uncle or something like that. So yeah, on Medicaid, SSI, Part D, the extra help with prescription drugs, those type of programs, you get to kind of recertification every 6 months, every year, depending on your particular case in your particular state. But yeah, if everything stays the same, then you should be good. If everything stays the same with you, you're normally good. But unfortunately, things are changing with Medicaid. In some states, I think there's 9 states that if Medicaid reimbursement rates from the federal government are cut, then those states will automatically stop the Medicaid expansion, and a lot of people are going to be losing that their Medicaid, their health care, essentially.
There's a question, Dr. Ed, from TJ about
Mm-hmm.
not having supplement plans in his Nevada county, which is news to me because typically Medigap is offered in each county depending on the state that you live in. And so I'm very surprised to learn that, TJ. And I think we need to know a little bit more about your situation. And perhaps you have Medicare by way of disability and you're not yet 65.
Yeah, probably. Or there's many places in Nevada that do not have Medicare Advantage plans. There's 0 Medicare Advantage plans available in some areas. So, but in terms of Medicare supplements, that's a state thing. So it's probably under 65, huh?
That's what I'm thinking.
Yeah. Wow. Can we switch to chapter next enrollment period? Absolutely. Yep. So are y'all taking, because it's getting close here. We're wow, this year is
5 months
flying
away.
by. Yeah, June is coming up. If they want to call you up, and can they schedule appointments yet, or they can call you up and get a feel for it, or talk to somebody now, or what can they do now in preparation for October, November?
Yeah, it doesn't hurt to have a one-on-one call with one of our Medicare advisors, and we're going to find out more about your situation. Potentially, there's an opportunity to help you now. If not, we'll let you know, or maybe you're on the best plan already, and then we'll reconnect in the fall to do a full coverage evaluation.
Perfect. All right. This is not a Medicare question, but I've seen this, so I want to address this. I'm getting dozens of spam calls saying I have been awarded the $6,400. So far, all of is a gimmick. Okay, so this happens every single time there's something like that actually happens. So this is a fact. There are people receiving $6,000, $7,000, $10,000, $20,000 of back pay going back to January 2024. That is a reality. Over $14 billion has been paid out to people that were subject to the Social Security Fairness Act, that were WEP'd and GPO'd. So it's basically the people that work for non-covered entities, their spouse work for non-covered entities. The Social Security Fairness Act was passed a few months ago. Social Security is processing those checks. $14 billion have gone out. People are receiving over $6,000. And when that happens, that is a reality. It happens. Scammers take advantage of it and said, "Hey, you've heard about these $6,000 government checks, right? Well, guess what? It's your lucky day. We've got it here. You just have to go down to Target or Walmart and get a gift card so you can pay for the shipping and handling from, So don't fall for that. If 2/3 of those calculations, those checks have already been sent out. There's about 3 million people that are part of the Social Security Fairness Act. 2 million have already been paid. There's another million that Social Security is working on. It takes a little bit more different calculations and different things. So they're going to take a little bit longer to do. But if you never worked for a non-covered entity, which is a state, city, local, federal government agency that did not pay into Social Security, or your spouse didn't pay into that and you're entitled to spouse benefits, then you're not going to get the $6,400 or anything like that. So yeah, it is partially true, but in many cases, these scams, and Social Security is not going to call you in that case. If they call you and say, hey, by the way, your ex-husband, he worked for the police force in Texas, and we are going to adjust his benefits based on the Social Security Fairness Act, then come on down to Social Security Administration because you have to file a claim. If you get something like that, then go down to the local Social Security office or call the 800 number, hang up on them and say, well, thank you very much for the information. Goodbye. I don't trust you. Sorry. Click. And then call the 800 number, 772-1213, and say, hey, do I have a lost long, ex-husband or wife that worked for teachers or whatever like that? And am I entitled to those benefits? And they'll tell you. But there are some people that are falling through the cracks that, they themselves didn't work for these non-covered entities, but maybe a spouse or an ex-spouse did. And they actually need to file for benefits. So this is what these scammers are taking advantage of. So that's how you address that. So sorry, I just wanted to
No, I love that.
throw
And
that out
Dr.
there.
Ed, I just learned something from the comments. I didn't realize that Pink Hibiscus posted that in previously Medicare Advantage insurance companies had told you how many providers they covered in the Welcome to Medicare book. If you have a copy of that Pink Hibiscus, I would love to see it from whenever that Welcome to Medicare book is from. I would love to look at that. I wasn't aware that had previously been published in the Welcome to Medicare book.
Yeah, the was the Medicare and You. Yeah, I don't remember seeing. I know in the back of Medicare and You, the books, it had a list of the Part D programs available in a particular area.
Right.
So
Right.
yeah, knew it
Yeah.
had that, but yeah,
This is why it's a big data problem, which doctors are covered, how your prescriptions are covered. This is really something that it took years for us to build. And if you go to Medicare.gov, you can't even see if the doctor that you're interested in, if they accept the Medicare Advantage plan of your choosing. It's really unfortunate, and it's something that our CEO testified to in front of the Senate Finance Committee.
yeah, he's a bit of a tech guy, isn't he?
He is. Yes.
And then
Yes.
some. That's
Spent
an
almost a decade
understatement of the
out
century, isn't it?
Yes. Yes. This is a big data problem. And so we
Yeah.
needed to build a tool to allow your viewers to compare all their plan options.
Perfect. Okay, this will be our last question. We're over an hour. I have Medicare Part A, Part B, and N. All right, good deal. I want dental and vision, and I don't want Medicare Advantage. Yeah, I stay with N. Stay with A, B, and N. You can't add Medicare Advantage. You can only give up your N to switch to Medicare Advantage. But if you're happy with A, B, and N, stay there. Can I just buy dental and vision from a private insurance company? And I always love how Ari responds to this because, a lot of Medicare insurance agents make some money selling dental and vision and stuff like that. But Ari and Chapter's response is,
You can buy standalone dental vision insurance. It is typically a ripoff to you because the amount that you pay to the insurance company is more than you get back in benefit. So if you have some big ticket dental work on the horizon, it could be a good value to purchase standalone dental insurance if you wouldn't be subject to a waiting period and you get to go to the dentist of your choice. If that's not the case, then it might not be to your economic benefit, and you'd be better off paying out of pocket for those cleanings.
yeah, so just talk to your dentist that you like and say, hey, my dental work, do you think insurance, would benefit, or, do I not need that much? And even if your dentist says, yeah, you need a lot, and we'll schedule it over this next year or two, and usually the dentist already has a dental insurance that they recommend, so you just sign up for that. So
Right,
yeah,
talk to the insurance coordinator at the dental practice. They're going to
Exactly.
be a
Exactly.
wealth of information as to which plans offer the best reimbursement if you want to go that route.
Even more so on vision. Yeah. Right. So, yeah.
Costco Lens Center works
There you
great.
go. There you go. There you go. So yeah, unfortunately, a lot of Medicare insurance agents that make extra money doing dental and all that hate us now. But hey, it's all about taking care
Don't
of
care.
people and saving people money. Exactly. Exactly. All right, we are over an hour. Thank you again for Ari. You're always very, very popular. I always appreciate it. So I think we're going to make this a regular every few weeks or so. You're going to come join us and help us out.
I'd love to.
All right, perfect. All right, y'all take care. And remember, have a beautiful day. And please, please, please take care of each other. Thank you, Ari. You take care of yourself and the little one.
Thank you, Dr. Ed. Be well. See
All
you
right,
next
take
time.
care. Bye-bye.